Welcome back. The National Council of Provinces is conducting oversight visits this week at Gauteng hospitals. The Maxeke Academic Hospital has not fully reopened since a fire gutted the infrastructure almost a year ago. And as a result, medical personnel at Hani, Baragwanath and Helen hospitals say that this has placed immense pressure on them. For more on this NCOP visit, we're joined now by Professor Lufuno Mathivha, who is the head of critical care at Hani, Baragwanath Hospital. Prof, a very good morning to you. Thanks very much for coming on to the program. This visit by the National Council of Provinces, what's your take on it, Prof?
Look, it should have happened a long time ago. And in fact, it shouldn't have been necessary for it to go that high. We knew we were in trouble with our hospitals the day Maxeke Academic Hospital was evacuated. We already saw the influx of patients to the other hospital. By the way, it's not just Hani, Baragwanath Academic Hospital and Helen Hospital that are overwhelmed. Rahima Musa is overwhelmed. Leratong Hospital is overwhelmed. Sebokeng Hospital is overwhelmed. Telemukherani is overwhelmed. Those are hospitals that usually refer to the central hospital. They've got no outlet now. When we talk about Hani, Baragwanath Academic Hospital and Helen it is a horror story because those hospitals were built to accommodate a certain number of patients, and they have always been at full capacity. And now they have to carry the whole of Gauteng in terms of patients and referrals. And it's sad because they're carrying that load. They cannot turn any way away. No hospital can go on divert while they sort their business and get more beds ready. The infrastructure does not allow extra beds to be included in the hospital. So patients have to wait on stretchers while they wait for beds. But the sad thing is our Gauteng Department of Health not even responding in injecting extra resources to those hospitals that are affected. When Maxeke Hospital is working at 50% at the most, let's say, what is happening to the rest of their budgets for goods and services? Would you not divert that budget to Helen and Hani Bara so that they can be able to process more patients and service more patients and get them out of the way so that they can then decongest the referring hospitals? The issue of mental health patients is back haunting us again as a province. They are congesting the Helen Accident and Emergency Department because they've got nowhere to be put. At Hani, Baragwanath Academic Hospital, we have a psychiatric unit, but it's full to capacity now. We also have nowhere to decongest the mental health patients, and we cannot send them out prematurely before we stabilize them. And then recently there was a talk of culling posts. How do you cull posts of a hospital that has chronically been short-staffed, that is operating on a staff establishment dated back to 2006, as a hospital that you have been under budgeting and only determining the budget on a historical basis? A hospital that is 3 times the size of Maxeke Hospital, and yet they have almost the same staff establishment? Is it because Hani Bara, Helen Joseph, and George Mukhari hospitals service the indigent patients that will not make noise and they're just grateful for the little health care they get, and therefore it doesn't matter? Is it because the staff that works in those hospitals are just passionate and hardworking and will continue innovating and improvising to deliver health care to those patients? Why would you not pay suppliers so that they can supply consumables to the hospitals? Did it have to come to the bread supplier supplying bread? Did it have to come to medical companies refusing to come and service equipment and repair it? There are so many things. And the National Council of Provinces seems to be only mentioning the overload of patients. What about the infrastructure they saw when they were walking around? Was that so good with them it wasn't worth mentioning? Because all our public healthcare facilities are suffering from old infrastructure, inhospitable hotel facilities for our patients that need to be flagged right now.
Prof, you've
Yes,
raised...
we can sing.
Prof, I'm sorry to interrupt you there, because it's so incredibly important for us to hear from you all of the issues, all of the struggles from, as you say, a number of hospitals in Gauteng, including Hani Bara. The Gauteng Hospital Services Deputy Director General, Dr. Freddy Gongwana, says the healthcare system is big and complex in Gauteng, but he says it is functional. Is that enough, Prof? That it's just functional, and by your account, it's just barely functional?
It is dysfunctional. It crawls along because there are dedicated nurses, dedicated doctors, dedicated allied healthcare workers, and dedicated general workers that make it work. If Dr. Freddy Gongwana was honest with you, he would have told you that we are constantly complaining at his door about the healthcare facilities. Yes, I can patch something, I can glue a mug together and still drink coffee from it. That ain't functional. I've just patched up things to make them work. When I run off antibiotics in ICU and have to spend the night phoning other institutions if they've got that antibiotic so that I can treat that patient, that ain't functional. That is dysfunctional mobilization of a crisis. When you threaten me with cutting posts and I have to try and reassure junior doctors that we will try and fight this, and then at the last minute the MEC intervenes with the Premier, and then the posts are then said to be guaranteed, which still remains to be seen. That is stressful. That is dysfunctional. That is moral injury to people that work there. The problem with administrators is they sit in offices. They don't walk the talk. They don't walk the corridors of these hospitals they're talking about. They rely on insufficient statistics that are sent to their offices, and they make up numbers. And they will get wrong numbers that don't even give them the number of activities and the level of activities, clinical, that are happening at those hospitals. So, no, the Gauteng public health system is trudging along.
Prof,
Prof,
let me ask you this.
Yeah.
Where, I'm battling to understand the lack of political will to effect change in the Gauteng health system. For example, when you talk about the funds that could have been diverted from Charlotte to other hospitals to help bolster the hospitals who now have to make up the backlog caused by the fire at Charlotte Maxeke. Instead, as you say, we see budgets being cut, we see staff complements being cut. So, Prof, where is the disconnect here between the crisis that's unfolding at so many of our hospitals in Gauteng and the lack of intervention to make the necessary changes?
I think to run a provincial Department of Health, and I also believe a National Department of Health, you need to actually understand the environment you are administering over, and you need to be in touch with that environment almost on a daily basis.
So this is what you've been talking about. These are administrators who sit in offices. They actually have no idea what's happening at the hospital on a daily basis.
Yeah, and some of them have got no clinical background. You have people that are not qualified to be working in the health sector. And I'm not talking about the hands-on people here.
Yeah.
I'm talking about people that are administering the health department. Mm-hmm. They have no clue about how a hospital works, no clue about how a primary health care clinic works. So right there, we've lost the course of the ship.
Yeah.
So we're busy pouring coal into the engines so that the steam engines can run, but we haven't charted a course.
Professor Lufuno Mathivha, I could sit here for the rest of this hour and discuss this with you because the problems in Gauteng Health are overcountable. But, Prof, unfortunately, we've run out of time. Hopefully you and I can pick up this conversation at another time. But let me thank you for giving us some of your time this morning. She is the head of critical care medicine at Hani Baragwanath Hospital.